Imagine discovering too late that a silent enemy is growing inside you. An enemy that affects 1 in 8 men and can be fatal if not recognized in time. Prostate cancer is the second most common cancer in men. But here's the good news. If detected early, the survival chances are extremely high. It is estimated that by 2024, more than 300,000 men in the United States will have been diagnosed with prostate cancer, and more than 30,000 people will have died from this cause. But what if I told you that many of these cases could have been avoided if the warning signs had been recognized in time? Today, we reveal 10 early signs of prostate cancer that many men ignore. In the end, you will also learn how you can reduce your risk through simple habits. If you are a man or know someone who might be at risk, stay with us until the end. This information could save a life. Before we begin, don't forget to like this video and subscribe to our channel to support us and provide you with more valuable content. What is the prostate and why should you care about it? The prostate is a small organ, the size of a walnut, but with a huge impact on men's health. It is located directly below the bladder and surrounds the urethra. Its main task is the production of semen, which is essential for male fertility. But here lies the problem. As we age, the prostate can become more susceptible to diseases, including prostate cancer. Prostate cancer occurs when abnormal cells multiply uncontrollably in the gland, forming tumors that can go unnoticed for years. Some of these tumors grow slowly and do not cause symptoms for a long time, while others are aggressive and can spread rapidly to the bones and organs. Many men only realize something is wrong when it is too late. The first symptoms are often discreet or accompanied by offensive symptoms, such as prostate problems like benign prostatic hyperplasia, BPH. This leads us to a crucial question. Is your body already giving you warning signs, and are you perhaps ignoring them? These are the 10 main symptoms of prostate cancer that we should pay attention to. The first could affect your daily life without you noticing. Number 1. Pain or burning when urinating. Have you ever felt a burning or painful sensation when urinating? Perhaps you thought it was just a harmless urinary tract infection or temporary irritation. But what many people don't know is that this symptom can be one of the first signs of prostate cancer. As the tumor grows, it can press on the urethra and make urination difficult, causing inflammation and irritation, leading to burning or pain. In some cases, cancer cells can even spread to the bladder or urethra and cause recurrent infections. When should you worry? If the burning sensation when urinating persists for several weeks or is accompanied by other symptoms such as frequent urination, difficulty urinating, or blood in the urine, do not hesitate to make an appointment with a urologist immediately. Early detection can save your life. Number 2. Frequent urination at night. Have you noticed that you need to get up more often at night to go to the bathroom? If so, it could indicate nocturia, a frequent and sudden need to urinate at night. Many people attribute this to age or drinking too much liquid before bedtime, but it could also be an early sign of prostate cancer. What happens in the body? If a tumor grows in the prostate, it can press on the bladder and urethra, causing greater irritation and less urine retention. Even if your bladder is not full, you feel a strong need to urinate. When should we pay attention? If you wake up more than twice a night to urinate suddenly and for no apparent reason, you should examine yourself more closely. If the problem is accompanied by a weak urine stream, pain when urinating, or blood in the urine, it could be a serious warning sign. Do not neglect this symptom. A visit to the urologist and a simple preventive examination can provide certainty and save your life. Number 3. Blood in the urine. Imagine going to the bathroom and noticing that your urine is reddish or pinkish. This could be a sign of hematuria, blood in the urine, a serious symptom that may be associated with prostate cancer. As prostate cancer grows and spreads, it can attack the blood vessels of the urethra, bladder, or even the kidneys, causing small amounts of blood to enter the urine. Danger. Not all blood in the urine means prostate cancer. It can also be caused by common urinary tract infections in older men, which can irritate the bladder, kidney stones, small stones that can cause bleeding as they pass through the urinary tract, or anticoagulants, some medications that can make blood vessels more sensitive and cause blood to appear in the urine. If you observe blood repeatedly in your urine, especially along with pain when urinating, frequent urination, or a weak urine stream, you should consult a doctor urgently. Immediate medical examination is necessary. A PSA test, urinalysis, and ultrasound can help detect changes in the prostate early. Number 4. Persistent pain in the lower back, hips, or legs. Do you have persistent pain in the lower back, hips, or legs? If so, it could be more than just simple muscle tension. It could be a sign that prostate cancer has already spread to the bones. Why does this pain occur? Prostate cancer has a dangerous property. In an advanced stage, it can metastasize to the bones, causing deep and persistent pain that is often mistaken for harmless back pain, but does not go away even after rest or taking painkillers. How is this pain different from normal muscle pain? Constant and increasing pain that worsens over time, located in the lower back, hips, or thighs without apparent cause, a feeling of weakness or numbness in the legs, possibly with limited mobility, pain that worsens during the night or when moving, different from normal muscle pain. If the pain persists for weeks or months without apparent reason and does not improve despite rest, you should take it seriously. This could indicate that the cancer has already spread to the bones. Seek medical attention immediately. Imaging techniques, such as magnetic resonance imaging or bone scintigraphy, can detect cancer cells in the bones at an early stage. The earlier the cancer is detected, the better the chances of recovery. Number 5. Unexplained weight loss. Have you ever looked in the mirror and realized you are losing weight without changing your diet or exercise routine? If the numbers on the scale are dropping for no apparent reason, this could be a serious warning sign and one of the less obvious signs of prostate cancer. As a tumor grows and spreads, it changes the body's metabolism, causing it to burn more energy than usual. Additionally, the immune system fights the disease and consumes more calories. Signs that your weight loss may be related to prostate cancer. Rapid and unexplained weight loss, more than 5% of body weight in a few weeks, decreased appetite or changes in taste, frequent feelings of weakness, and extreme fatigue. Make an appointment with your doctor and undergo tests to determine the cause of your weight loss. Number 6. Pain in the rectal area. Do you have discomfort, pain, or persistent pressure in the rectal area without an apparent cause? Many people ignore this symptom because they think it is temporary irritation or an intestinal problem, but it can actually be a sign of advanced prostate cancer. The prostate is located just in front of the rectum. As a tumor grows, it can press against the rectal wall, causing pain, a feeling of heaviness, or even difficulty defecating. If the pain persists for weeks and is accompanied by difficulty urinating, if the symptoms are accompanied by unexplained weight loss or blood in the urine or stool, this should be taken seriously. If you have persistent discomfort in this area, consult a doctor and have a thorough examination. Tests such as a rectal exam, PSA test, and ultrasound can help detect serious diseases early. The earlier the diagnosis, the better the treatment options. Number 7. Pain when sitting. Do you feel pain or discomfort when sitting, even on soft chairs? If so, you may be ignoring one of the less known but important signs of prostate cancer. The prostate is located just below the bladder and in front of the rectum, in a sensitive area of the body. If a tumor develops within the prostate, it can exert pressure on the surrounding tissue and cause discomfort. If the cancer is advanced and has spread to the pelvic bones, the pain can be even more intense when sitting. The signs that this pain may be related to prostate cancer. Persistent pain in the pelvic area that worsens when sitting for a long time. A feeling of pressure in the perineum, between the genitals and the anus. Discomfort when sitting that improves with a change of position but never completely disappears. Pain that worsens when coughing, sneezing, or making sudden movements. If the pain persists for several weeks and is accompanied by symptoms such as difficulty urinating, blood in the urine, or persistent back pain, it is advisable to consult a doctor. Number 8. Difficulty urinating. Have you noticed that it is becoming increasingly difficult to urinate? The urine stream is weaker or interrupted, or you have to strain to start the flow. This can be one of the most common signs of prostate cancer. If a tumor grows within the prostate, it can narrow or block the urethra, the duct that carries urine from the bladder to the outside. This makes urination difficult or even impossible in more severe cases. It is possible that the bladder is not completely empty, which can lead to more serious complications. Number 9. Loss of bladder control. Imagine being in the middle of a meeting, taking a walk, or simply at home watching TV, and suddenly realizing you have lost bladder control. Urinary incontinence is an embarrassing symptom for many, but it can also indicate serious prostate problems. Prostate cancer, especially in advanced stages, can affect the nerves and muscles responsible for bladder control, leading to uncontrolled urine leakage. This can happen in two ways: urge incontinence, a sudden and uncontrollable need to urinate that prevents you from reaching the toilet in time, and overflow incontinence, where the bladder does not empty completely and urine leaks uncontrollably throughout the day. If urinary incontinence occurs more frequently or starts suddenly, especially in combination with other symptoms such as difficulty urinating, pelvic pain, or blood in the urine, you should consult a doctor immediately. Number 10. Pain during ejaculation. Intimacy should be a moment of pleasure. But what if, instead, it causes pain? Many ignore this symptom or attribute it to stress or fatigue, but it can be one of the first signs of prostate cancer. The prostate plays a crucial role in the male reproductive system because it produces part of the semen. Sudden cramps in the legs at night. If the pain during ejaculation persists for weeks and is accompanied by other symptoms such as urination problems or pelvic pain, do not ignore it. It could be a sign that something is wrong with your prostate. What causes prostate cancer? Risk factors every man should know. Now that you know the 10 warning signs, it's time to understand why prostate cancer occurs and who is at particular risk. Science still does not have a definitive answer, but there are some well-established risk factors that increase the likelihood of developing this disease. How does prostate cancer develop? Prostate cancer occurs when cells in the gland multiply uncontrollably and form a tumor. But what makes these cells become malignant? Researchers have identified some probable causes. Advanced age. The risk of prostate cancer increases dramatically after age 50. Approximately 60% of cases are diagnosed in men over 65. Family history and genetics. Men whose father, brother, or grandfather have prostate cancer are at twice the risk. Genetic mutations such as BRCA1 and BRCA2, also associated with breast cancer, can increase the risk. Ethnicity and race. African American men have a higher risk of developing prostate cancer and often present with more aggressive cases. Asian and Hispanic men have a lower risk. Obesity and lifestyle. Overweight or obese men have a higher risk of developing aggressive prostate cancer. A diet rich in saturated fats, red meats, and low in vegetables can increase the risk. Chemical exposure. Toxic substances such as industrial chemicals and pesticides may be associated with an increased risk. Having one or more of these risk factors does not mean you will get prostate cancer, but your risk increases. Therefore, it is important to maintain a healthy lifestyle and undergo regular checkups. Even if you do not have any symptoms, you should have regular examinations with a urologist if you belong to a risk group. Early detection is the best way to ensure successful treatment and avoid later complications. How can prostate cancer be prevented? 5 habits that can reduce your risk. Although the disease cannot be completely prevented, studies show that certain habits can significantly reduce the risk and improve overall health. Research shows that lifestyle has a direct impact on prostate health. Small changes in your habits can make a big difference over time. 5 important habits to reduce the risk of prostate cancer. Eat plenty of fruits, vegetables, and whole grains, which are rich in antioxidants that can prevent cell damage. Include tomatoes and broccoli in your diet, which contain compounds that can protect the prostate. Avoid excessive consumption of red meats and highly processed foods, as they are associated with an increased risk. Men who engage in physical activity at least 3 times a week have a lower risk of developing aggressive forms of prostate cancer. Exercise helps control weight, improve circulation, and reduce inflammation in the body. Obesity is associated with a higher risk of aggressive prostate cancer. If you are overweight, losing some weight can significantly reduce your risk. Be careful with vitamin E and selenium supplements, as studies show they do not reduce the risk and, in some cases, can even increase it. Obtain your nutrients directly from natural foods rather than supplements. Attend regular checkups and talk to your doctor if you are over 50 or have a family history of prostate cancer. You should consult a urologist annually. The rectal exam may be uncomfortable for many men, but it is quick, painless, and can save lives. Most importantly, prevention starts now. Prostate cancer has a high cure rate if detected early.